Bismillahirrahmanirrahim. Assalamu alaikum. Dear colleagues, we are in the series of communication. We had 3 sessions till now. In the first session, we learned what is communication, from which word the communication has derived, what are its components, and we learned that the communication is a bidirectional or two-way process. Then in the second session, we learned and we discussed the components of speaking, that there are 3 components: the verbal component, the paraverbal component, and the non-verbal component. Then in the third, that is the yesterday's session, we discussed the components of listening, the active listening, and we learned that the 3 components, these are the verbal component, the paraverbal component, and the non-verbal component. Today we shall summarize the whole thing, and we shall discuss how we can make our communication as an effective communication. To understand the effective communication, we know that the communication is the process of exchanging information, ideas, or messages between individuals, groups, or organizations through a common system of symbols, signs, or behavior. This is the whole nutshell summary of what we learned in the last 3 days. That communication is the process of exchanging information, ideas, or messages between individuals, groups, or organizations through a common system of symbols, signs, or behavior. It involves the transmission, reception, and interpretation of information and can take many forms. It involves the transmission, reception, and interpretation of information and can take many forms, such as verbal communication, which is speech, phone calls, video conferencing. All this is verbal communication. Then non-verbal communication, like body language, facial expressions, and tone of voice. Third, it can be written communications, like emails, letters, and texts, the text messaging. Number 4, it can be visual communication, like images, videos, or graphs. And 5th, it can be interpersonal communication, like face-to-face interaction. So the communication can have one of these 5 ways or forms: verbal communication, non-verbal communication, written communication, visual communication, and interpersonal communication. Effective communication involves the number 1, clearness of the words, of the thoughts, conciseness in the words, in the message, accuracy of the message, of the word, completeness, it should be a complete message, timeliness, appropriateness, it should be appropriate messaging of the time, and feedback. Unless you have feedback in a communication, your communication is not going to be a successful or effective communication. Communication is essential in all aspects of life, including personal and professional relationships, education, business, and healthcare. It helps to build trust, resolve conflicts, and achieve goals. Excellent communication skills, these are essential for effective collaboration and patient care in our clinical setting. And here are some key communication skills for consultants in a hospital setting. And I would like to share those with you. Number one, clear articulation. Consultants should be clearly articulating, clearly conveying thoughts, ideas, and plans to the patient. Then active listening. Please pay attention, understand, and respond appropriately to your client, to your patient, to your counterpart. Number three, empathy. Show compassion and understanding towards patients and colleagues, and even to your team members. Number four, clarity. Use simple, concise language to avoid confusion. Number five, non-judgmental. Avoid making assumptions and jumping to conclusions. Number six, respectful. Treat others with respect and dignity. Number seven, open-minded. Be receptive to diverse perspectives and ideas. You may get very different perspective and idea from your colleagues, from your patients, from your team members. Be ready for that. Cultural sensitivity. Be aware of and respect cultural differences. Conflict resolution. Address conflicts in a constructive and respectful manner. And of course, adaptability, adjust communication style to suit different situation and audiences. This is very, very important. So by owning these communication skills, you can foster strong relationships with patients, with colleagues, with hospital staff, with organization staff, and leading to better collaboration and outcomes of the patients, of the company, of the team, and of the projects. So, dear colleagues, in these four sessions, we learned what is communication, what are its components, what is the process of communication exactly is, the speaking, the listening, the speaking, its three components, verbal, paraverbal, and nonverbal. Then active listening, its three components, verbal, paraverbal, and nonverbal. And then we learned what is the effective communication and how we can be a good communicator. I hope my these three brief sessions had made you able to understand the process of communication. If there are any comments, any questions, any queries, please do ask me in the comment section and I will try to answer that. And if needs some further elaboration on the subject, we can have future discussion on this. Take care. Goodbye. Khuda Hafiz.